Okay, so I'm gonna call to order. It's 7:05, March 3rd, 7 p.m. Yeah, it's 7:05 now. So we'll start the meeting, got 9 participants. And I'm gonna go around and introduce everybody. And I'll call on you. So I'm Caroline Kinsella. I'm the health director. Laura,
I'm Laura Richards. I'm the chair.
Mary. I can't hear you, Mary.
Pardon me, board member and secretary, Mary Stenson.
Roxanne.
Hi, Board of Health member.
Hi, Jean.
Jean Peterson, Senior Clerk.
And Carolyn.
Carolyn Ho, I'm the health agent.
Lisa Stevens, good night.
My name's Lisa Stevens. Good night. I'm the Director of Tobacco Control with the Mass Municipal Association.
Thanks for joining us tonight, Lisa. I appreciate it. Would anyone else like to introduce themselves? I think Dr. Susan Milton might be having some technical issues. Can you hear us, or can you?
I can hear you now. Can you hear me?
Good. Yes.
All right,
No, you've
good.
been emailing
Dr.
me,
Susan
so-
Milton, just interested party. Recently retired and thought I could maybe help.
Excellent. Thank you. Would anyone else like to introduce themselves tonight? Hearing no one else, I will.
Sorry, Deborah Milbauer.
Hey, Deborah. So moving along, I'm going to go to number 2, approval of the meeting minutes. So these are the meeting minutes from January 6th. If the board can take a look at those meeting minutes, see anything that you'd like to change or add.
I had looked at those before. I didn't see anything.
I was fine with them. I looked at them this afternoon.
I'm fine with them.
I'm happy to make a motion to approve the minutes of January 6th.
I'll second. All in favor? Aye.
Great, thank you. Next is number 3, it's citizen speak. Is there anyone who would like to speak, have an opportunity to speak at this meeting? Now's your time to speak.
Okay. I'd be glad to give a presentation at any time. If anybody needs some information or anything a deep dive on, I'm glad to help you guys.
And what's your specialty, Susan?
I was a PCP, internal medicine.
Would anyone else like to speak? The citizen speak? We'll see no one. We'll move along to number 4. It's the Board of Health discussion of additional proposed regulation changes to the Board of Health Regulations, Chapter 5, sale of tobacco products to minors, and Chapter 6, Board of Health Regulations, smoking in the workplaces, public places, and membership association. So we've had a couple of meetings already regarding our tobacco regulations and updating the tobacco regulations. And Lisa Stephen Goodnight has been invaluable helping the board review the regulations, but I can pull them up. Let's see if I can pull up the regulations. We can start on Chapter 5. So we have Chapter 5 and we have Chapter 6. Let's see if I could share this here. Okay. It's Chapter 5. Can everybody see that?
No. Oh, yes.
Okay, bring it up to the top. So Emily and I went through the regulations again to put into the regulations all the changes that the board would like to have on the regulations for Chapter 5. If you go through it, the regulations, you'll see that there is one area that we had to kind of go back to. That looks, if I go down a little bit here, I'll show you where it is. There it is right there. So oral nicotine pouches can only be sold in adult-only retail stores. Right now, we don't have any adult-only retail stores, and we won't have any adults, hopefully only retail stores. But this was on the regulations from the state. I guess my question to you, Lisa, is, and I think I had said this before, do you think we should leave that in there? Number G, oral nicotine pouches can only be sold in adult-only retail stores, retail tobacco stores.
Yeah, so if you don't have any retail tobacco stores, generally that one tends to get a lot of pushback and may not be the best policy. We have also had some towns that have put a limit on the amount of nicotine that can be in a given pouch. So that, and limited to either 3 or 6 grams per pouch. Another alternative that has seemed popular with towns that don't have adult only stores. So that way, especially like popular things, but product would be available to people. It would be really contents very concerned wouldn't be available. So it would just restrict the access to the kind of the more higher concern things while we get more data on the product itself.
So what's the name of the product that?
So the oral nicotine pouches are the products overall. Zyn is the most popular. Zyn
Yes.
and Snoo are the two most popular. Not Snoo. Zyn and On are the two most popular brands right now. But we've seen, and one of the areas of concern is that we've seen some very high nicotine content products that are kind of like the off-brand ones in particular that go up to as high as like 28 or 30 milligrams per pouch, which is very, very high. Zyn itself goes.
You're kind of going in and out. I didn't hear how high Zyn was.
Sorry. Zyn goes up to 9. 3 and 6 are the two amounts that have been kind of approved for sale by the FDA recently. So that's why those are the two numbers that have been put that have been proposed. The language is very simple. It just says that no product higher than a certain amount will be sold in the town. So I can send over that language, but it's just a quick sentence that says that. And that just puts a little bit of a restriction on these products so that you're not getting the really high nicotine amounts being sold in your town.
How does the board feel about that? Putting in that language?
I think
So-
that would be great.
The language as it stands? Is that what you're saying, that the number G, leave it the way it is?
Well, that
They're limiting the
Lisa
amount of
would put
nicotine.
the amounts of milligrams that are the lower ones. Should send the language over explaining that.
So I guess my only thought would be, would it be better just to leave it the way it is here? I mean, because right now, then they can only be sold in adult only. We don't have that. And so,
So
I
would
mean, I'm
that
just,
mean- yeah, so that's a good question, Lisa. The question is, I believe they're selling Zyn right now. Carolyn, is that true? Because you did the tobacco inspection. Are they selling the Zyn right now in the stores and in the retail tobacco stores?
I believe so. I think the last tobacco we do them annually. It's coming up on a little over a year, or it's coming up on like the 1 year since me and Emily did it. But I believe we did see some, just like in the stores that do sell tobacco here and there. Not like too much. It was mostly the cigarettes, and vapes and cigars, I think. But we did see some here and there.
So maybe it is a good idea to do then the amount she's pointing out. I think if we do that, we would have to do some education to the businesses about that as well. So, I mean, I'm sorry, I would want to make sure that if we do that, which I think is fine, but the amounts that we're also educating the business owners on that, because I bet they have no idea about, that we're looking at the amount.
Now looking at that statement, oral nicotine pouches can
Mm.
only be sold in adult-only retail tobacco stores. So is it like one or the other? Is it, we don't put that language in there, but we do put the language about like no higher than 6
You
grams?
could do both. As if you do the adult only, you would be effectively banning them in Milton.
Right.
So that's kind of that's why the strength is just another avenue that, especially for towns that don't have adult only stores, we found popular because it still provides this product which people are using.
So number G is more restrictive. And it'd have to be taken out of the stores. It's in the stores right now. So would the board be okay with removing that and then putting about the like no higher than 6 grams? Is it grams or milligrams?
Milligrams.
Milligrams. 6 milligrams.
I'm fine with limiting it to 6 milligrams. When do
Okay.
we expect these to go into effect? If we give them notice, can they
Hmm.
sell what they have or return what they have?
So after tonight, we'll have one more meeting that it will be a public meeting. So we'll ask the retail tobacco owners to come,
Mhm.
and any resident can come too and give their input
Okay.
at the next meeting.
And this is Lisa. You can build in a buy down period into when they go into effect. I mean, you can make some towns have like different rules, but generally you as a board can decide when the effective date is, and a lot of towns will do that where they'll have kind of a buy down date, so that retailers aren't stuck with a ton of product that they can't sell.
Sounds good.
Yeah.
I think that was in chapter 5. I think that was the only area that we had to discuss. I'll look back down, but I'm pretty sure that was it. Is there anything else that you saw in the regulations that you wanted to change or add?
No, not me.
I'll get that language from you, Lisa. You can change that the next
I will send it
meeting.
over as soon as we get off this call.
Perfect. Do you want to move on to chapter 6?
Yes.
Okay. Hold on. Chapter 6. Okay, so this is chapter 6. Let me pull this up here. So one thing that's different than chapter 5 and chapter 6 is that chapter 6, the statement of purpose has been minimized. And I know, Roxanne, you had said that we didn't need it. I don't know if you want to address that again or think that you'd like to have that put back in. Or Lisa, maybe you can tell us about the statement of purpose. If you recommend that we keep the statement, well, all those like whereas secondhand tobacco smoke contains 7,000 chemicals, including hundreds of chemicals, the whereas. Would you recommend that we keep that in under statement of purpose? Or can we just simplify it to what you see right there? And that's the old regulation.
You could probably keep it like that. There's enough evidence to support that's the danger of secondhand smoke that that you probably can. And I do believe some towns have kind of parted down that much. I let me just check, but I think that should be fine. Like I said, there's plenty of evidence that's pretty generally accepted that you probably don't have to cite the specific ones.
I think that was my question, you know what I mean, is that it's already understood, so, I don't know, it just, if we needed all of that, or if we could have just simplified it because it is a generally understood principle, that's all. That's where I was coming from with that.
Mhm.
Yeah, and I believe you can. I just want to confirm to make sure there's not something I'm missing.
So the statement of purpose that we see here is just from the old regulations. It's simple. The purpose of this regulation is to protect the health of the employees and general public in the town of Milton. I'm just going to move this down a little bit. And we were talking about, again, if we're going to leave these definitions. So anything that's in yellow, we were kind of going to come back and talk a little bit more about is the state regulation or the local regulation. Do you have any recommendations, Lisa? If we should leave that in under definitions?
You don't have any, right, currently in your town? Right.
Correct.
Right. The difference is just that the state allows the use of tobacco products in adult retail tobacco stores, whereas locally you can choose not to allow that. So if you don't have any, it may be fine with just the state definition.
Do you want to read the state definition, Board? Adult-only retail tobacco stores, also known as retail tobacco store under 105 CMR 665.005, an establishment which is not required to possess a retail food permit, whose primary purpose is to sell or offer for sale.
Oh, I'm losing you guys.
But not for resale tobacco products and paraphernalia in which the sale of other products is merely incidental, and in which the entry of persons younger than 21 years old is prohibited at all times, and maintains a valid permit for the retail sale of tobacco products as required to be issued by the appropriate authority in the city, town, or other legally constituted governmental unit within the Commonwealth where the establishment is located. I think Lisa recommended the state, but we're losing Lisa.
Sorry, it cut out a little bit. So as I said, because you don't have any adult-only retailers, the local definition is really aimed at kind of creating some additional restrictions on how they conduct business. And if you don't have any, either one will work, but they won't really have an effect either way, because they don't operate in your town.
So I guess I would probably say that we should stay with the state one, and then, I mean, I think that's what I was thinking, the state. We don't have them in, whatever's the one that would be more applicable, I guess,
Yeah,
Lisa. I would do that because we don't have that, and we could always amend them later if need be.
right.
But
But we've prohibited adult retail.
Right, so
tobacco
it just
stores.
seems like, why would we,
Yeah, I think go with the state.
Yeah, that's what I was thinking.
Okay, so I'm going to keep the state. Move this down a little bit. So this is still on the definitions here. Things down. So this is short-term rentals. I know you'd asked me, Roxanne, to contact the building department about this, and I did contact Jay at the building department. He said there's no short-term rentals existing. He said they're not existing. They have new ADU regulations that are coming out as of February 3rd, but their planning board is looking at those right now. So there's really nothing on the building side. I don't know if you want to just go with the state regulations, or if you, as I said, we don't have them. We don't have these regulations in place right now. I don't know what's your opinion, Lisa? by adding these?
So if it's something you're concerned about, or if there's a possibility that you will have short-term rentals down the line, this is a good move. A lot of like hotels, Airbnbs, they're all restricted in smoke in a similar way. So this is kind of just to make sure that the same standard is applied to these short-term rentals as well. If I don't, you wouldn't be opening the door for short-term rentals by putting this in place if there aren't any in Milton. So it would just, I think it's kind of one of those, you have to kind of make the decision, but it's probably, it can be worthwhile having if there is a concern around short-term rentals and if you have them or think that they may be coming down the line at some point.
So I guess what I would say is right now, they were still working on the regulations in town meeting. They started to look at how the town could do some things regarding length of stays and the ADUs, and so that has not been finalized. So I'm wondering if we should see what comes out of that first. Like, this is February, and I know hopefully they'll have something together for May and we'll know a little bit better about this. I'm wondering if we should hold off on this section till we know, because, there is talk around how long of a time period with the ADUs will be a minimum and so forth. And short-term rental, what is really the length of stay and so forth. So, I mean, right now we technically don't have that. So I guess I'm just thinking we may need this kind of section, but I don't know if we should be putting it in now until we see if it's going to be applicable, I guess, is my question.
That's
may
probably a
not
good
apply.
idea. That makes sense to put off on this section.
Yeah, I mean, it might be applicable, it might be fine, but we don't really know that yet. So I would rather see what comes out of it for the length to see if it is applicable. That would be my take on it.
I agree.
Sounds good.
Moving down.
So we'll reconvene on that. Okay.
I know we were touching on this previously, if we wanted to expand it to include municipal parks, playgrounds, and pools, municipal athletic fields and courts, municipal forests and wildlands. Or do we want to stay silent on this? Lisa, have you seen other towns put these regulations in, or what are you seeing on your end?
Yes, a number of towns have put these in. I don't have the list in front of me at the moment, unfortunately, but and some of them do, I think, around kind of concerns about the waste. So because, it's considered a hazardous waste, especially with like the jewel pods, and nicotine is considered that. So sometimes it's about the waste as well as the secondhand smoke issue. That's why I think a lot of have chosen the kind of like the wild lands, or a number of towns with like beaches have prohibited it for those reasons, because they don't want the contamination kind of spill over. So that's why, like, yes, it's outside and it's not, the same as being trapped in a room, but the environmental impacts don't just kind of stop at the smoke.
Right.
It'd be hard to enforce.
I was just thinking that.
Yep. I mean, unless we put fines in place or whatnot.
But it would still be hard to enforce, because by the time you got down to find someone, they're gone.
I don't know if I'm allowed to speak here, but it seems that it would be more protective to have it in there, regardless whether we can enforce it or not, in case there was trouble that we would have to enforce it. Without a regulation, then it would take a regulation first, and then we would have to enforce it. Is that true?
Yes.
Do you think the issue is that you brought up, Laura, is true though, because in terms of, you know, there are so many things that need to be looked at and enforced. I mean, is this something that will really do just because we have it on the books? I mean, I don't know. I mean, we're asking
Right, they
people,
might,
yeah,
they'd be asking us to enforce it,
right. I mean, if you have
which
it on the
would
books
be,
and you don't enforce it, it can be a problem too. So,
right,
I mean, most of the times there are signs at a lot of the places I noticed, like athletic fields and things like that. But now in municipal forests and wildlands is a little, you know, there's so much area. I don't know how that would get enforced at all.
right.
And then the Blue Hills, of course, is DCR.
Mhm.
I see that Susan has raised her hand. I'm just going to ask Laura, who's our chair, if you'll allow Susan to speak.
Yes,
Thank you, Laura. I had an office that was in a peculiar spot in Milton, and that's the 88 Wharf Building. And that also had a lot of activity with children that are there right at the wharf. And also when they had the farmers market that was right outside the T stop. And that's particularly what I was thinking of. It is a beach, so to speak, and we don't have that written here. And I don't know that that's legally called a park there, but that would be a source of, more contamination, wildlife that comes up the wharf. We routinely saw seals and the eagles and, everything that comes up in that area. So, you know, if there was a lot of contamination, that would at least give us the ability to maybe cut it down if we had a regulation in place.
I just feel like if we have a regulation in place, we'll be asked to enforce it. If anyone sees anything, and it would be pretty impossible to do that.
But who would that be? Unless there was a problem. It would only be if there was a problem, correct?
No, there'd be plenty of people who would say, oh, I saw a cigarette butt here, and I saw, I think,
Oh, okay. Okay.
I mean, I'm not positive, but I could see that happening.
Okay.
Would it be prudent to do like a distance from a certain area? From say like a buffer zone or something around even like a shoreline, or just suggested parameters. Does DCR have any regulations in that regard that maybe we don't know about?
I didn't think they did, unless you know of something, Caroline. I don't believe they do.
We
I'm
could
not aware.
we could reconvene on it when we reconvene on the other language.
I mean, we could think about those things, but I
find
mean,
out-
I do hear what Laura's saying, because every time we put something in, there's an expectation that you're going to really enforce it. And, while we
How
may
do we
think
do it?
it's not a great thing for people to do and so forth, I just worry about the enforcement people, part of it, We should just, I don't know,
wanna
what do you
just,
think, Laura?
Yeah, I mean, I think we should, I'm leaning towards not putting them in, but I'm also happy to think about it and reconvene when we do the
do you want
short-term
me to,
rentals.
do you want to think about it, and then you can individually email me
Okay,
what your decision is? If two of you says just not to put it in, then
okay.
we can proceed like that if you want to think a little bit more about it.
Yeah, that's fine.
Okay, so I'm going to say that you're going to be emailing me and thinking about it, and you're going to email me. Okay. Okay, then it says a guest room in a hotel motel. We don't have any hotels or motels. We don't have any inns that I know of, or bed and breakfast or lodging homes that is designed and normally used for sleeping and living purposes.
Right. And
Should
the
we
same
take
with the short-term rentals. I mean, I think it's the
Right.
same issue with earlier when it was mentioned.
Mhm. Do you want to remove those? Remove I and J.
I think you should for now. We certainly don't have a hotel, motel or inn or any
Yeah,
of
we
that.
should definitely get rid of the I.
Yeah,
Okay.
Then wouldn't the short-term rentals depend on,
right. It depends what the short term, what the length of
Yeah.
stay is for ADU. So I would remove it for now. But,
Okay. That's it. Is there anything else that you saw in here that you like to revisit? If not, then I'll just wait for your email about D, E, and F.
Okay.
How's that sound?
okay.
I'm fine with the rest of it.
Yeah.
Any other questions for Lisa Stevens Goodnight before she
Says good night.
says goodnight?
Says good night, yeah.
No, I have none, thanks.
I don't. Thank you very much.
Welcome. Thank you guys for having
Thank
me.
you.
Thank you.
Thank you very much. Thanks for coming. Guiding the board. All right. Okay, I'm gonna move on. Let's see, so next is the health director's report. I keep on adding to this here, health director's report, because I had put together some notes earlier in the week, earlier in last week, and a couple of more things have come up. So Roxanne and I met with Norwood Town Administrator and the Norwood Health Director about that healthcare capacity audit and hospital closures in the area. I did send another email, Roxanne, to 2 more contacts that I know. And basically they just said we have to reach out to someone at the state, the right person, I guess, at the state. So maybe we just haven't found that yet because they didn't know the answer. I'll have to circle back with Stacy, the health director.
Oh, yeah.
In Norwood to find out, what they're creating is like a task force in Norwood around the closure of the Norwood Hospital. And they are trying to get some momentum to get that reopened. So,
Yeah, I mean, the focus, if I can just jump in for a minute, the focus of the meeting was really, they wanted to meet with us because of our letter that was really focused in on healthcare capacity audit that the state should have been doing in terms of looking at hospital beds, especially with Kearney closed and Quincy and Norwood and in this whole Norfolk County as well. So that was really to just try to get some of the towns around us to try to write letters as well to get the state to do that because anybody that works in healthcare sees what's going on, and people are waiting for beds. They can't get beds. They're having to get diverted. It's just not a good situation. And so, I think that the data would support whatever it supports, and that's what we had said to Norwood is that, where our focus is really looking at the healthcare capacity and asking the state to do what they should have already done. And I would hope that other communities would do that because I think given the lack of hospital beds everywhere, especially in our area, South Shore, Norfolk, it's a real problem. And so that's really where we're coming from that. And Norwood has been their town administrator has been working on getting a task force for his area to try to do something about this. So that was, so he talked a little bit to us about what they were doing. We just said that, we think that we really should be pushing for this capacity audit that should have been done because then the data would probably support possibly reopening. We don't know, but our focus is really on making sure we have enough beds for people here and anybody else that might come to live here.
agreed,
So that
Roxanne,
was-
well said.
Oh, thanks.
Well said. And so another thing is we had a QPR training last week. I wasn't able to go to it because I was out, but it's called Question, Persuade, and Refer Training. We had a training for employees, town employees, and also residents. It was led by Bay State, Laura Rosenthal. We didn't get as many people as we hoped. We'll run it again in the fall. But Laura said even if we have our training for one person, it will you know, be helpful to residents or even employees. So it was worthwhile to go ahead and have that training. So, and also we had a radon webinar when I was away also. And I think that it was pretty well attended. Myself and Pat Neves, my neighbor, wrote a radon article, and then a webinar by Stephanie Santoro from the state. And so I think that went well. And we just found out this week that we can put it on the our website, the health department website, so people can watch it. I still have to watch it. So it just got approved this week that it could be posted on our website. So that was good about the radon. Let's see.
Great.
PR. Right now we're doing a community survey for the opioid settlement funds. I think you may have gotten this in your packet. I hope you can take the community survey. So that was a survey that we put together with our consultant, and we're just reaching out to the community to get some feedback of how the money should be spent. So I believe we have about 80 people that have responded so far. So we're hoping to get some more people to respond to that opioid settlement survey.
Did you get any feedback, Caroline, on was it hard to access? Because somebody reached out to me and said they went to that and it didn't open up well or something. I don't know.
I haven't heard that. I actually had my son do it yesterday.
Okay.
And
Okay.
have any problem accessing it. So
Okay,
think-
that's good to know.
yeah, so it should be good to go because he did that yesterday. So
Okay,
he's gotta do it.
perfect. Good.
And there was an opioid grant opportunity that Margaret Farrell's made me aware of. It was for $1,500, and it's coming from the Norfolk County. They're getting opioid money too, and then they're trying to disperse it further down to the towns, and we could have, I didn't want to leave money on the table. So what we're going to do with the $1,500, we put in a proposal for this. Anyway, we have to get it approved from Mr. John Cronin, who's the Norfolk County Director. But it was, we put in the request to send 2 children to the Milton Park and Rec Camp for a 7-week session. And now it's $750 to send 1 child to that Park and Rec session. So we can send 2, and this would be to benefit children that come from families with members impacted by opioid addiction. So we're hoping to get that grant, and we can, either the schools will identify some children, and maybe our social worker will to have two children attend that Park and Rec. That's a nice opportunity. And then
That sounds good.
to mention also is that we're continuing to get support for the Milton Coalition. We got a $200 grant from the First Parish in Milton. We got a $184 grant. I can't say grants, money that's coming in for the Sekhar family. So who that is Maya Sekhar. I don't know if I'm saying her name right, but she went to the CADCA National Leadership Forum, and she raised $184. So that's coming into the Milton Coalition. So that was great news. The 2 grants. And then let's see what else I have to talk about here. The state right now is conducting a foundational public health service review of every health department in the state. And it's quite extensive, the information that they want to get. They want to get all the information about what kind of services are we providing in our health department. They want to know who's in the health department, how much they're getting paid, how much revenue we're generating, how many grants we get. They're looking overall to provide these foundational public health services throughout the Commonwealth. And so they're just trying to get an idea of comparisons of like what our town may be able to offer as other towns and try to fill those gaps. That's what they're hoping to do. So they're conducting this. It's taken a little bit of my time to put in all this information. I still have to get more information before I fill it all out. So that's been a process, but we get it done. Also, I just wanted to say that Riverside Community Care, we finally signed the contract I did today for the recovery coach. I know we've been talking about this for a year and a half. So this is Norfolk County 8, and we have a behavioral health service agreement between Riverside Community Care and Milton now, which went into effect March 1st, and it's going to end actually June 30th. And then it will, we'll see how it goes in the next couple months, only 4 months. But I sent all this information over to Chief King, Jenny Bellevue at the schools, our veterans agent. Ann knows about it. She's going to contact Riverside to see exactly, what they can offer Milton and see if we can help some residents with recovery services. So more to come about that, but that's a first step. We've been working on this. So this is going to be paid out of the opioid money. And it's a long time coming to get this contract in place. So I'm glad it was finally signed by me today, and it's in force. So
That's
we're
great.
working on that. That's good. Let's see what else. Riverside. Laurie Stillman is working on the community health improvement plan. So actually, I just saw her email today. And so we've got a first draft. I'm going to look at it this week. I'm planning to look at it with Laurie and just go through what she's seeing. We're counting up all the, after we had our meeting, just counting up, what's risen to the top. What areas can we seem to tackle? And what other areas can other committees or other town departments can tackle. So a couple of things rose to the top: the communications, maybe having a health consortium, age-friendly designations. I'll send this all to the board. As I said, this is just the first draft, and so we're going to be looking at that and seeing, what areas rose to the top. And as I said, what areas we can tackle and where some other town department can tackle or committee can tackle, or Partnership for a Healthy Milton might be able to tackle. So I'll send you guys that and you can take a look at that. I just also wanted to talk a little bit, just touch on, we did get a message from Nancy Bersani that there was 8 Canada geese that were in the Neponset River, and that someone must have told her about. So she did contact the state about that. They were too far down in the river, but it looks like the avian flu for the 8 geese. And we've seen that in Plymouth too. We don't have any positive avian flu that we've heard of in Milton, but you're supposed to call the state if you see more than 5 birds or carcasses or whatnot, that dead birds, and then they could come out and test them supposedly. But Nancy wasn't going to take the chance of trying to get those birds. So
Right.
We're just gonna wait and watch and see if there's any more reports of it. But that was the first time that Nancy had said that about those dead birds in Milton. And the state said, the state said they'll be swept downstream and they'll eventually sink or end up in a location where someone can retrieve them safely. So just to notify, I think on mass.gov you can notify too. You can maybe even self-notify if you see dead birds, 5 or more. So just keeping it on our radar about the avian flu. And then I did want to touch on 5 to 9 Thatcher Street. And if you'll remember, board, that in December of 2020, this property is the old Knights of Columbus.
Oh, yeah.
And where NSYNC is, it's right behind the Milton Food Mart. So at the time, this is in 2020, I contacted the state about this property. There was a complaint that came in about trash on the property. It did have a fence around it, but there was trash and there was like tree limbs, and it was all taken care of at that time. So we sent out a correction order to the owner. They made corrections to the property. At that time, I even contacted Tara Ruddle, and Tara Ruddle's with the Neighborhood Renewal Division. So she came out at that time. We had the state, we had Tara, and actually we did have a board meeting, and the owner did come. So everything was fixed, or everything was remedied on the property. It was secured. It was all cleaned up. And so then we haven't heard anything. So fast forward here, we're 5 years later, we got a complaint about the property that it was an eyesore. And what are we going to do about that? So I asked the board again, should we contact Tara Ruddle again to see if she can come out? At that time, we didn't do anything. We didn't condemn it. As I said, it was satisfied with what happened. So it's still in the same state of disrepair. My staff went out, and there's a fence around it, but the fence wasn't secure in two places. Someone could go in and get in through the fence and go into the area. And I'm not sure how secure the two buildings are. So the ask was, let me see, I can even pull it up. I have it here. I'll share it with you. Here's a correction we sent out. Okay, can you guys see that? So this is the correction order. It looks the same. Oh, this is 2020. So a lot of things were wrong in 2020. This is the correction order for 2020, but it's basically the same, except not as much stuff. We only saw that this fence wasn't secure. But if you remember, I'm going to go down a little bit. In 2020, there was like all kinds of rubbish at this area. Let's see. Let's go down a little bit more. And so back then in 2020, it was all cleaned up, see all that the garbage and stuff. And they did do what they were supposed to do. They secured the building, as you see. They secured any kind of way for them to get in. But here we are again. And actually, I did email Tara, and this is what she said. I'll read it to you. I just pulled up her email here. So she's still working there. So she said, if the town is interested in referring this property for a possible receivership action, we will be happy to schedule a time to meet at the property and assess the current condition. As you likely recall, if the property is deemed a fit for our program, we would then perform a title search to identify any party with a legal interest in the property. We would then send a demand letter to those parties informing them of the possibility that a petition for an appointment of a receiver may be filed. So that's what she's suggesting.
So who did we send the order to clean up to, if we don't know the owners?
We do know who the owner is.
Oh.
Yeah, let's bring it up to the top here. Because the owner did come into our board meeting, or had a representative. He did have a lawyer. So the owner is Milton Thatcher LLC, but there is someone that they responded. And actually, Jean, you're on the call. You said that somebody did call last week. Did they leave a phone number? Because nobody left any phone number on my line. Did you say somebody called? Is Jean on this? Jeannie there?
I am on it.
Did
I
anybody-
thought that the person, I thought he did leave a phone number. I didn't indicate the number to you.
I didn't see it. Do you think he left it on my desk and I have to
I
look
mean,
further?
he may have said that he would call back. Maybe it was that type of call.
Okay,
Sometimes that happens too. They don't want to leave a number, so maybe that was the case.
okay, okay,
I kind of don't really remember. But if he had left his number, I would have indicated his number.
okay,
Maybe he just didn't want to. I
Okay.
told him you were out, you know, so
Mhm.
maybe he preferred to call back.
okay. All right, let me, I checked all my messages this morning. I didn't have a message, but I'll check again tomorrow. Maybe he's left a message and I'll follow up. He has to at least secure the fences at this property. I can reach out, to Tara Ruddle if you would like to have her come out and assess the situation again. And I can contact town council. What do you think, board?
That's probably a good
I agree
idea.
with that.
Yeah.
Yes. Yep.
All right, let me do that. Let's see. Let's see. If there's anything else. Do you guys got any questions for me?
Carolyn, whatever happened with, was it Smith Road?
Oh, yeah.
So we're kind of in a holding pattern with Smith Road. I think that, I've reached up once or twice up to the building department. Unfortunately, the director of the building department left, maybe a month or two ago. But I don't think there has been much movement with Smith Road that I've heard of anyway. I don't know. They can have contractors come in and take a look at it. And they said they were going to. So we're kind of in a holding pattern, at least for 1 year. If they don't do anything in a year, then the Board of Health can take action.
Mm-hmm.
So.
What type of action would we take? Like, just, can we order it to be torn down or?
You can order it to be torn down.
Hmm.
Mhm.
And how often, Caroline, are we going up and like checking the property and making sure that it was secure?
I haven't been up there. I can take a look again since we secure, they put the fence around it. We put our notice up there, but
No
the
neighborhood,
applicant can take a look and see.
No neighborhood activity, no calls.
yeah, no complaints or anything.
Once in a while, Chris Martin will come in. He's come in
Mhm.
twice to say, like, have you heard anything? And I said,
Right.
no. So,
Yeah, I think the neighbors are pretty good up there about checking to make sure like it's secure. I mean, they did mention, one of the neighbors mentioned to me that they have had some contractors going in and out, but like nothing's been pulled or anything.
Mhm.
And they certainly would let us know if there's anything else going on there. And it is posted. This particular neighbor said it was posted, that it's condemned and so forth. But so I think that neighborhood, after everything that's gone on, I think they're pretty good about letting us know.
Mhm.
But certainly worth taking a ride, Caroline, when you have a minute, which is probably never, but
we can take a look and see.
yeah.
Yeah.
But I mean, that's the feedback I've gotten from it.
Yeah,
Okay.
I definitely think Chris Martin would come by and tell me if something was going on,
Mhm.
or
Yeah.
tell me to get up there and take a look because he's right next door. Yeah. Anything else?
I don't have anything.
No.
Okay. All right. Let's see, I'm gonna move on. Let's see. You want to set a date for the next meeting?
Yes, but don't we have to have a quick one after the election? Would that be our next meeting?
We have a meeting maybe before that, or?
Probably before that, we should have a meeting, I think. I
Okay.
mean, our election's the 29th, so.
Oh, it's the 29th. Okay.
Yeah.
Yeah.
So-
So that's a long
Oh,
time.
yeah. Mm-hmm.
So
Is
you
it
probably have
April
something
29th?
before that. Yeah,
Okay,
yep, soon.
okay, do you want, do you want to look at something before April 29th then?
Yeah.
I mean, 5 weeks is what, the 7th? Is that the 5
Yeah.
weeks?
Yeah. What am I doing?
Calendar here. 7th.
think the 7th works to me, as
Mhm.
does, yeah, the 7th.
Yeah, the 7 works.
Yeah, it seems to work for me.
Okay, so, April 7th at 7 PM? Does that work?
Yeah,
Okay,
sounds good.
All right, perfect. Great, thank you, board. Thank you, everyone.
Thank
okay,
you.
thank you.
Thanks,
Thank you,
everybody.
Caroline.
Thanks,
Bye-bye.
Caroline.
Take care. Thank you.
Okay,
Bye.
bye-bye, thanks.
Bye.
So, adjourning
Oh.
now at 8:01. Board, will you adjourn? Vote to adjourn?
Yes,
Yes.
yes.
Vote to adjourn.
All in favor? Adjourn.
Aye,
Aye.
Okay, thank you.
thank you.
Good night, thank you.